Milk thistle is wonderful. Citrus pectin will bind heavy metals. There's a number of good nutraceuticals that will bind heavy metals, and so those are all good to have. They have EDTA in suppositories, so you don't have to see a doctor and get an IV. I think the only oral EDTA that works is if it's bound up in lipids, and the trouble with that is they just taste horrible.
Hmm. Well, I take a number of supplements, all kinds of supplements. So can we just talk about supplements, what you recommend? I'm a big fan of turmeric. I take that every day. I've seen cancer disappear, polyps disappear from people. And I'm a big fan of turmeric for a number of reasons. So could you talk a little bit about turmeric and a little bit about other supplements that you recommend?
Yeah. Let's talk about briefly about causes of cancer before we get to that, because what you spoke of was turmeric and curcumin, and then the ultimate extraction of that is BCM 95. But these agents decrease inflammation.
Mm-hmm.
And so that's one of their primary effects on as an anti-cancer agent. Anytime you decrease inflammation, you're going to decrease cancer. One of the few pharmaceuticals that I do approve of that everyone should probably be taking is metformin. But it was originally derived from a natural substance to start with. It's an old agent, probably 30 or 40 years old, to lower blood sugar, but it increases PMK activity, it increases energy, it increases oxygen usage, it decreases blood sugar, increases insulin sensitivity. It just does so many things. And that's another reason that I use thermography to work with my patients, because it's the only test out there that can see inflammation. You can literally see inflammation with thermography. There's no CTs can't see that, MRIs can't see that, ultrasounds can't see that. So I want to know where the inflammation's at. But inflammation is a cause of cancer. And so anytime you decrease inflammation by turmeric, curcumin, SAMI, there's a lot of things to reduce inflammation. And so anytime you reduce inflammation, you reduce cancer risk.
Mm-hmm. Okay. Now, what are some of the other supplements that you recommend to people? I'm sure D3 and iodine, I mean, people are deficient in D3, that's for sure.
D3 is the #1 natural anti-cancer agent, period. Nothing else even close to it. So I recommend 20,000 international units a day. And my cancer patients, I'll have them on more, maybe 30 or 40,000. I'll get a D3 level from their blood and see exactly how much they need and titrate them up. But D3 is absolutely your most important natural anti-cancer agent out there. And then vitamin K is right behind that. K1, K2, K3, a nice mixture of that. And with those two, they're a nice 1-2 knockout punch for cancer. They're very important for prevention. We live in these houses and work in businesses, and we've got artificial light. And while some of us, if we live in San Diego, are able to go out in the winter and get a little bit of sunshine, direct sunshine, and create vitamin D, most of us aren't.
Right. What do you think of selenium?
Critical to cancer prevention.
Mm-hmm.
Now I have a saying, cure is the prevention. So cure is prevention. And so it's all about prevention. Selenium's critical. I use sodium selenite because I think that's a little more effective for cancer prevention and treatment than other forms of selenium. But any selenium is better than no selenium. And I was reading a report the other day that said all of our soil was from Congress. and it was saying that all of our selenium was dangerously depleted in our soils where we were growing crops for people. The report was dated 1939. And I don't think there's any farmers or ranchers or crop growers putting selenium back in the ground. So we've got a second and third generation now that's depleted of selenium, and it's one of the causes of our increased cancer.